Hey everybody, Dr. Michael Bowman here. Recently did a training session for some primary care practitioners in the area about how to do a nasopharyngeal swab, which is how we do the COVID testing. So if you're interested about what might happen or what's involved with getting tested, please check it out. I hope you learned something. Please let me know if you have any questions down below. Thanks.
Sit them up like in a chair, up against the wall, or bring the seat of your thing up so they don't, do that pullback number from you. That'll be helpful. If you do it in the car, that works well too.
Just have them lean up against the
Yeah,
seat.
yeah. So first have them blow the nose, so you get hopefully all the mucus out, so you're not catching that, but you're just getting all the way to the back of the nose before you get anything.
So we need tissues then too.
And then wear appropriate PPE depending on what you're doing. I'd use your otoscope or a little flashlight just to take a look inside their nose. You may not be able to get as good an exam as I can with my speculum, but at least if you see that there's a lot of tissue on one side, go to the other. For you, kind of take a little. And so, you've got mild septal deviation to your left. I see a little bit of pink on the left side that don't on the right, so we'd use the right side. And the main thing to probably remember is that it's going to be a lot further back probably than you think otherwise. The other thing is that, for a flu swab, you're kind of going up and back, trying to get up to the middle turbinate area, and that frequently will generate a sneeze. Obviously, you want to avoid sneezing if you're really concerned about a COVID patient. And so we were trying to stay along the floor of the nose. So you're going to have to kind of get over the little sill there, but once you do, you're kind of driving straight back parallel with the palate. So you're going to be aiming towards the ear canal. Is the right direction.
So I usually go there for the flu, so I should be actually aiming it up a little bit.
I don't know about the flu actually. I often see people just kind of jamming, putting it up in the nose in that direction, which I'd have to go and look and see how the flu swab's supposed to be done. But I see people doing that all the time.
Because I always thought I was supposed to go more back.
If it's more nasopharyngeal, then this is the appropriate technique for that. But if you're doing it right, you shouldn't get a sneeze or a cough. This is usually where we drive our scopes through when we're doing a flexible laryngoscopy, and sneezing almost never happens down there. You only get sneezing when you go up and looking into the sinuses a little bit more. So you're kind of going straight back, aiming towards that ear canal, and most of the time with when you're going to be going back probably about that far, 6 or 7 centimeters, a lot further than you think. And so as you go back, hopefully you won't feel any resistance. If you kind of get, say that far and you meet something, I would probably start by aiming a little bit laterally, because it's probably the septum you're running into, and just kind of gently wiggle and keep pushing gently as it goes back. It shouldn't take a lot of force. Once you get back to the back, you're about that deep and you feel it hit the back wall, you just spin it a few times. I think it's supposed to be 10 or 15 seconds actually.
So let's see, this thing, I guess it ends about here.
Yeah, so you're gonna go in most of the way. We'll see. I probably may have overestimated a little bit. It's probably about 7 centimeters or so, a little bit further than you think. And then get back there, twist, 10 seconds, as long as they'll let you tolerate, and try to withdraw straight back. You're trying not to accumulate a lot of gunk from the front part of the nasal cavity, because the viral count's highest in the nasopharynx, is where the shedding happens. And also kind of warn the patient that, it's going to be a little uncomfortable. I usually will tell them it's not going to hurt, it's just going to feel really weird. And it might burn a little bit, it's not bad, it'll bring a tear to your eye. Sometimes closing their eyes seems to help a little bit. But you okay with me trying it on you? I'll let you do it back to me.
You made Adrian get it done. You got this.
So, should we do it? So,
Of course I
if you're,
This is your payback.
if you really are doing it, so I would probably stand off to the side a little bit, so you're not in sneeze blast radius, something like that, and kind of hold the back of the head. So you're going to go up to get into the nostril just a little bit, and then even it out, so we're just going straight back towards that ear canal.
Oh, Dr. B.
Twist. I got the sneeze.
I got a band on.